Our future is going to be dealing with different crises and dealing with unknown. And so we need to build our stress resilience and build our robustness so that we can be healthy and cope well with the different stressors and disasters that life in this new world is going to throw at us.
Hello, I'm Valerie Hoffman, and I have the pleasure of being joined today by Dr. Elissa Epel. She is the director of the Aging, Metabolism, and Emotions Center, as well as a professor of psychology at UCSF, the University of California, San Francisco. Thank you, Dr. Epel, so much for joining us today. It's a pleasure.
Thank you, Valerie. It's really my pleasure.
Okay, so tell us, what exactly is integrative mental health and how does it differ from our traditional view of mental health?
Mhm. It's a great question. The traditional medical model treats mental health with medications as uh, early or primary first line of treatment. And there are just disappointingly so many problems with that approach. For example, as many people know now, depression is not easily treated with drugs. And in cases of severe depression, we can see effects that are better than placebo. But with all the rest, the common depression that most people have, it's some meta-analyses suggest that it is similar to placebo or not much better. And so that's terribly disappointing. I'll just say that I don't discourage people from trying the medications because if they're lucky, and they work on their brain, then that's great. It's just that for most people, uh, the kind of cost benefit analysis is not great, meaning that the benefit is minimal, if any, and the cost is side effects. So there are definitely different side effects. There are some of these um, drugs that are used for different mental health conditions that are just blatantly addictive and really hard to get off. And people just suffer, and the drug companies don't really admit how problematic these drugs can be. So Effexor, for example, is one that's terribly difficult to get off of. So integrative mental health is a superior model for treating the common mental health problems we have. Right now, we have an epidemic of mental health conditions with anxiety and depression being in, clinical levels and over a third of our greater population. Now, we don't want to label that, oh, those are psychiatric disorders and these people need medication and it's a disease. This is a normal, common response to tremendous stress, twin epidemics, racism, the virus, now climate disasters. I mean, our future is going to be dealing with different crises and dealing with unknown. And so we need to build our stress resilience and build our robustness so that we can be healthy and cope well with the different stressors and disasters that life in this new world is going to throw at us. So integrative mental health really builds the resilience in people and boosts their health. And there's many different things that fall under that umbrella of integrative mental health. So I'll just name some. So it might be exercise. We know that a regular program of aerobic exercise really can help mild to moderate depression. So if people can get a supportive structure and keep up the activity, it is actually an antidepressant. So that is just so important for people to understand. Of course, getting enough sleep. Having poor sleep, we think, is a major highway between experiencing a lot of life stress and developing depression. So we want to really bolster people's resilience by helping them prevent sleep loss from stress. Nutrition and supplements are part of integrative mental health, a very important part. And again, this is an area that the public is just not privy to. And having read these research studies, it's amazing how much more we can do to bolster people's mental health with nutrition. So just to give a quick summary, we know that in many population studies, a junk food diet is associated with depression and anxiety, whereas a Mediterranean or whole food diet is related to much better mental health. And further, there are some studies that are using supplements, such as micronutrients, and finding that can bolster people, that can help with a range of common issues, ADHD, possibly depression. And it can even, in some studies, bolster what we call stress resilience. So these people who are taking micronutrients fare better when they're dealing with an earthquake or a natural disaster. They're less likely to fall into more severe depression and anxiety.
Excellent, excellent. It sounds like there's so many benefits. Is there actual scientific evidence behind some of these types of treatments?
So that is really the million-dollar question, and the answer is yes, but it is not a huge literature. We don't have drug companies funding these studies, and so we're at a real disadvantage to run these big multi-site clinical trials. But there absolutely is an evidence base of randomized clinical trials for many integrative mental health techniques or strategies. So there for exercise, there are many trials and reviews. In terms of nutrition, this is so new that people are starting to try to manipulate nutrition for depression. So for example, it's been an uphill battle because depression is not necessarily caused by poor nutrition. There are many different pathways to depression. So why would nutrition help cure it? And what the studies show is it does help. So one randomized clinical trial has shown that improving the diet of people with major depression led to much more remission than any drug study has ever found. And the control group there was actually peer support, which is a very important active control group. So that's very exciting that nutrition may be one of the many integrative treatments. And then, of course, there's different pathways to reducing the stress response, the stress arousal in our body, and the stressful thoughts and the rumination that come with being a stress sensitive person and that can develop into depression. So mindfulness-based strategies are very helpful in terms of really targeting depression or anxiety. It takes a weightier program usually than just mindfulness. So mindfulness-based cognitive therapy has been shown to be as effective as medications in meta-analyses. And so this is very exciting to have it on the map in, medical journals like New England Journal of Medicine to get a stamp of approval like that. That's a very high bar for evidence. And it's really commendable and exciting that Meru Health has incorporated mindfulness-based cognitive therapy into its platform. It makes it a very unique company. And just the fact that you guys are pulling in integrative medicine techniques, realizing that it's not one shoe fits all, is a very exciting platform.
Excellent. Well, you've convinced me and hopefully some of the listeners about the benefits. So if someone wanted to start adopting some of these integrative mental health, where would you suggest starting?
Oh, that's such a good question. I would first want to know from them what they think some of the different uh, let's say lifestyle habits are that they um, maybe that help make them feel down, make them feel stressed, and what they think helps improve their mood. So I wouldn't take someone who's sedentary and doesn't like exercise and start with exercise. I think that's a tough path unless they really want to. So when someone asks like, what's the best time of day to try meditation or to exercise, the answer is the best time of day is the time of day that works for you, that you favor, that you're going to adopt and make a habit. And so much of this depends on what people like. We return to what we like. And so once we can get to a point where exercise actually feels good, doesn't feel good at the beginning, especially if you're depressed. But once you can cross this kind of physiological threshold so that you get some of the endorphins from it, then we get into this positive feedback loop, the cycle where they feel the benefit. And so that's so rewarding. And so the next day they're going to get out again. And so having the kind of the feedback, the pleasure, or the meaning in something really helps us make it a habit.
Yeah, yeah. So, how did you get interested in integrative mental health? What initially attracted you to wanting to study it and make it, part of your career?
Well, that's a really good question. I have been studying how stress gets under the skin and affects health, affects how we eat and how quickly we age, and looking into the cell. And so those questions have led me to these different natural techniques for really um, bringing out kind of the restorative power of our body and our mind. The things that we can do that make us feel good are often or that bring us well-being are good for our physical health. So, there's pleasure and there's kind of happiness, joy, and the quick pleasure of substance use and overeating and comfort food um, is, is something that is certainly uh, our brain can easily get hijacked to be in that addictive loop. And it doesn't bring pleasure. It brings more misery. It brings the short-term pleasure that then leads to kind of this um, dysphoria and this wanting more of it because it didn't last. And so when we try these holistic things, yoga, meditation, exercise, these are actually bringing us to a more of a balanced state when we can feel well. What does it mean to feel well, to feel vitality, to feel energy, to feel at ease? And so there's two ways to get there. There's ways that we can relax and calm and restore. And so that brings us to more of the practices like yoga and meditation. And then there are ways that stress out the body in these healthy ways. So these high arousals, natural behaviors that we can engage in. And they actually may have antidepressant qualities too. So exercise is the best example.
Mhm.
I'm studying something called the Wim Hof method. So this is kind of inducing a positive stress through this really rapid breathing as well as cold exposure. And while in the moment where, that doesn't necessarily, it's the opposite of relaxing, right? We're kind of exciting the body but then then it recovers. And it's that recovery process that we think is really creating restorative activities in the cells and in the brain that may be having antidepressant effects. So we're currently testing that. There have been studies on other types of stressors like hyperthermia, infrared sauna, and it turns out that in the small study so far, that may have a very potent antidepressive effect, possibly through inflammation, reducing inflammation. So these different ways of thinking about what works for my body, what do I need, is really an experimentation of trying things out. And so for something like mindfulness-based cognitive therapy, it alone is it's wonderful if people can really see things differently and really adopt some of the mental habits it brings. But then to use some of the body techniques too is just so important. We need a toolbox.
Yeah, yeah. There seems like there's so many of those tools in this toolbox. So okay, for our viewers, what would you say is the main take-home message from our chat today?
So I would do a little bit of a self-assessment and say, what do I do that's the worst for me? What are my habits that are really hurting my health? And looking at things like what you eat, how sedentary you are, how much you sleep, or stress, and just choosing one. Just an entry point could be one of these. And so, for example, with stress management, when people can actually find something, and maybe it's a short daily yoga class, but find something to bring down their anxiety,
Mhm.
that opens up opportunities to then maybe have the bandwidth to learn some new skills like MBCT. But so I would say, where's the lowest resistance? What looks most appealing to you to try first?
Yes, excellent. Great advice, Dr. Epel. Thank you so much for being with us today. Really enjoyed this chat, learned so much. I thought I knew some things, but there's always room to grow.
There's so much for all of us to learn here,
So much.
Valerie. I feel like this field, it shouldn't be new because,
No.
these are often, very traditional or even ancient
Yes,
practices, but we need to bring them into these clinical trials and show that they work. Thank you so much, Valerie, for your work helping people with different mental health issues right now. One of our, top priorities for
yes,
our whole population, for our whole globe.
absolutely, absolutely. It's a trying time for sure. Well, thank you again, and take care.
Thank you.